afternoon, Senator Craven, members of the Health and Human Services Committee. My name is Mary Mayhew, and I am the Commissioner of the Maine Department of Health and Human Services. My testimony today is in support of all 4 bills being discussed today that reform Maine's TANF program. These bills support our desire to move people back to work and self-sufficiency while also ensuring that taxpayer dollars are used for the essentials of everyday living. LD 8, you know what? I am not going to go through each of the bills. You've heard that for now nearly 2 hours. So let me jump to really the heart and soul of why we believe these are so critical.
You get the prize.
Now, what prize might that be?
I'll look for one.
Okay, I've got some ideas. All right.
You don't have to come back.
Yeah. Don't make promises you can't keep. Limiting the use of TANF funds for the basics of everyday living for a family in need aligns Maine's laws with the program's intent and makes common sense, and more importantly, aligns us with federal requirements. Every dollar spent on alcohol, tobacco, lottery tickets, or bail is a dollar taken away from a child in need. Clearly limiting purchases to within Maine state lines will prevent abuse by people living out of state and ensure that in-state residents are receiving benefits and tighten oversight of TANF cash assistance. Early analysis of data supports this legislation. When looking at benefits spent out of state by individuals for more than 2 consecutive months, more than $1.5 million was expended over 18 months. In addition, more than 2,600 transactions were made with a TANF EBT card out of state for 6 consecutive months, totaling $835,000. We can eliminate all of these transactions with legislation that does not allow out-of-state purchases. The requirement for job-ready applicants to complete a work search before getting benefits and the elimination of the loosely structured exemptions supports the goal of this administration to help people find meaningful work that can support themselves and their families. Work participation is a federal requirement of the TANF program and has been for nearly 2 decades. The Personal Responsibility and Work Opportunity Reconciliation Act of 1996 established sweeping reforms of all welfare programs and established many mandates around work participation. Currently, the department allows for, and Holly identified these, 13 different exemptions from meeting this requirement. In addition, Maine statute currently allows TANF participants to pursue a 4-year college degree and not meet the required federal work activities. Federal requirements allow very few exemptions that include caring for a disabled family member, being a recipient of Social Security disability income, or being a VISTA volunteer. When it comes to education, the federal government permits just 1 year of exemption from work participation over the course of a person's lifetime. I want to make it clear that we are committed to encouraging and supporting education and skills development of our TANF recipients. However, failure to meet federal work participation rates comes at a significant cost to our state in terms of federal penalties. The work that we do supporting education must align with federal rules. For the years 2007 to 2010, the federal government notified Maine that it faced more than $13 million in penalties for failure to meet work participation rates. We did not meet work participation rates in 2011 and 2012 and have not met the 2-parent rate for 2013. We are now facing additional federal sanctions for these years as well. Here in Maine, just 1 out of every 9 2-parent TANF households meets the workforce participation requirements. We need to do better and must continue to use all the tools available to us to assess TANF recipient skills, identify training and work opportunities, and provide support that ultimately leads to a rapid return to the workforce. As has been mentioned here today, DHHS has been working with the Department of Labor, the Department of Education, Adult Education, and other local and regional partners to move applicants back to work as soon as they are ready. All TANF recipients now receive a vocational assessment, and we have seen early success in finding work for those who are ready. These vocational assessments are providing an individualized pathway that identifies the individual's strengths, interests, skills, abilities, as well as their barriers that need to be addressed, such as substance abuse or mental illness. These targeted assessments will allow DHHS to better serve these individuals and to provide a warm handoff to our career centers. Additionally, we are partnering with the Department of Labor to develop an individual's critical employability skills and help them successfully transition to employment. Work experience opportunities focus on an individual's vocational interests and develop essential employability and occupation-specific skills. This will involve efforts with worksite development specialists and worksite supervisors to design, implement, and manage a work experience plan. As also has been stated earlier, the Employment First legislation supported by this legislature underscores the value of work in terms of self-esteem, community engagement, family stabilization, and independence. We are working on eliminating barriers for some of those who need help, including people in recovery and those with disabilities. Our culture is transforming to one that focuses on strengths and what a person can do. This legislation offers one more incentive and requirement for those who are work-ready to pursue employment. We plan to strengthen our partnership with the Department of Labor and help TANF applicants create a profile within the job bank as soon as they apply for benefits. Again, at last check, 6,900 jobs were available through the job bank. We want to make sure that we are aligning our resources to support the jobs that are today available. We must continue to move these programs forward to ensure that we are offering people a helping hand up and that our scarce resources should support those who are doing all they can to move out of poverty and into independent living. At the same time, we must support the integrity of our public assistance programs and reduce fraud, waste, and abuse. I appreciate the opportunity to address the committee. You have had many questions, detailed questions of background and data, and certainly I can seek to try to address some of those. I don't want to depart from your public hearing process. Beth Ham, our director for the Office of Family Independence, is here and certainly provide more detailed responses, but I'll leave that up to you if you'd like her to address you now or be prepared for the work session, and certainly we will try to gather as many of the detailed background documents based upon your questions thus far to try to get those in front of you.